Welcome, everybody, to Your Healthy Heart, a presentation from Dr. Carolyn Dean, author of The Magnesium Miracle and also innovator of many wonderful medical technologies, including the ReMag magnesium formula, which you're going to be hearing about a little bit more today. Before I bring Dr. Carolyn Dean on, I just want to let you know that she is a doctor and a naturopath of many, many years of experience. She's well known for all of her books and also for her radio show, which is Monday evenings on achieveradio.com. And she is here today to share with you some really super important information about how you can protect your heart and also recover your heart health through proper nutrient and nutritional supplements. So let me bring her on to speak with you, Dr. Carolyn Dean.
Thank you, Ginney. Hello, everyone. My qualifications for talking to you today about a healthy heart is that personally I had, and this is in the past tense, severe magnesium deficiency, causing me to have heart palpitations, insomnia, neck and shoulder pain, leg cramps, back spasms, even rectal spasms. Yes, TMI, too much information. But what was happening in my body, I didn't realize until I started to do the research for the Magnesium Miracle. And I wrote that book in 1991. It came out in 2001. For my work with magnesium, probably initiated by the book, I've received the Arrhythmia Alliance Outstanding Medical Contribution to Cardiac Rhythm Management Services Award in 2012. And that was from the reputable Heart Rhythm Congress of the Heart Rhythm Society in the UK. And what I have to say about magnesium and the heart is that the most frightening impact of magnesium deficiency is on the heart. In the next slide, I want to basically give you an overview of what magnesium does. It's all outlined here, although in the books I've written, the Magnesium Miracle, for example, I go into much more detail, of course. But magnesium is necessary for the activation and proper functioning of 700 to 800 enzyme systems in the body. This means it's catalyzing most of the chemical reactions in the body. It helps synthesize protein, stabilizes RNA and DNA, transmits nerve signals, relaxes muscles, whereas calcium contracts muscles. It produces and transports energy called ATP, and yet your doctor thinks it's just a laxative. In the next slide, I just have a couple of heart statistics. See, we don't really know that much about the heart. We just know if it stops, then we stop living. And it is scary, as I said, when you have heart symptoms. But basically, all we know is that the normal resting heart rate is 60 to 100, and the average is 72. And that the heart provides blood with oxygen and nutrients to the whole body. And unfortunately, at this point in time, there's an epidemic of heart arrhythmia. And what I said about my symptoms, where I had leg cramps, it started as leg cramps, and then muscle tension and spasms, and then the insomnia. It wasn't until later on that my heart started reacting to the lack of magnesium. But what's happening now in the world is there's a lot of heart rate monitoring going on, even to the point of a new Apple Watch app being used so people can follow their heart rhythm. And there's also, I heard recently, an implantable device that you can leave inside your body for 3 years so you can follow your heart rate. Now, this is just, in my opinion, embedding fear in people. In the next slide, I'm just mentioning the most important fact about the heart is that it has the highest amount of magnesium in the body, the heart is one big muscle, and magnesium governs all the muscles and nerve structures in the body, the structure and function of muscles and nerves. The signs of magnesium deficiency I identify in the next slide. We've got hypertension, where the smooth muscles of the arteries become tense, they go into spasms, and they do that when they're deficient in magnesium. High cholesterol, even elevated blood sugar, are caused by lack of magnesium. The electrical conductivity of the heart and the brain require magnesium. And if the heart isn't conducting electricity properly to create your heart rhythm, you have arrhythmias. The calcification of the coronary arteries can occur when you're deficient in magnesium. The coronary valves also can become calcified. Medication side effects include the draining of magnesium, heart failure. You require magnesium to prevent the heart from failing. Even broken heart syndrome requires magnesium. In the next slide, I'm talking about a recent study, this November 2017 study called Subclinical Magnesium Deficiency, a principal driver of cardiovascular disease and a public health crisis. So this is recent. This is very important. This is written by a Dr. James D. Nicolantonio and two other doctors. What James is talking about is so incredibly important. I just want to give you an overview of his credentials. He's a cardiovascular research scientist, a PhD at St. Luke's Mid-American Heart Institute. He's the author and co-author of over 200 medical publications and serves as the associate director of the British Medical Journal's Open Heart publication. And what he's saying here in the abstract, this is in the abstract that can be found online. He's saying because serum magnesium does not reflect intracellular magnesium, the latter making up more than 99% of total body magnesium, most cases of magnesium deficiency are undiagnosed. So serum magnesium, it's what's used in hospitals and clinics and all the laboratories. They do serum magnesium. It does not reflect intracellular magnesium. That would be the ionized magnesium blood test. It's only available in research labs at this point. We talk about the magnesium RBC test, which is a little bit better than the serum magnesium, but basically people have to go by their clinical measurements to determine if they personally need magnesium. Doctors just stand by the serum magnesium, and therefore, as James says, most cases of magnesium deficiency are undiagnosed. The second point, furthermore, because of chronic diseases, medications, decreases in food crop magnesium content, and the availability of refined and processed foods, the vast majority of people in modern societies are at risk for magnesium deficiency. I say it's 80% of people are deficient. And then the third point, subclinical magnesium deficiency increases the risk of numerous types of cardiovascular disease, costs nations around the world an incalculable amount of healthcare costs and suffering, and should be considered a public health crisis. That an easy, cost-effective strategy exists to prevent and treat subclinical magnesium deficiency should provide an urgent call to action. What's the easy, cost-effective strategy? To give people magnesium so that they are no longer magnesium deficient. So he said all that I usually say. when I talk about magnesium deficiency, what causes it, why doctors don't know about it. Um, Instead of looking at the vitamin and mineral cofactors that run every metabolic process in the body, doctors focus on the use of drugs, and they use clinical guidelines for these drugs that are no more than drug recipes for conditions that are due to magnesium deficiency. This brazen attitude, I say, is actually killing hundreds of thousands, maybe even millions of patients. In the next slide, I'm starting with hypertension as probably the first sign of magnesium deficiency in many people. They don't recognize the leg cramps or the insomnia or the muscle spasms, but when a person has hypertension, that takes them to the doctor, and they start getting pulled into the medical cycle, especially when the new blood pressure guidelines are making half of the adult US population hypertensive. They're saying that 120 over 80 is normal and 130 over 80 is the new high, not 140 over 90. And drug therapy aims to try to bash your blood pressure down to 120 over 80. Doctors know high blood pressure is the start of heart disease, and they think they can prevent it by lowering your blood pressure, but they don't know that it's often due to magnesium deficiency, and that blood pressure drugs cause more magnesium deficiency and make blood pressure even worse. In the next slide, I talk about this quite a bit, the downward spiral toward heart disease, beginning with hypertension. So here's the scenario. You go in for your annual physical, you're under stress. Stress burns off magnesium and it tightens up the smooth muscles of your blood vessels, causing high blood pressure. The blood pressure becomes elevated. Your doctor says it's time for you to take a blood pressure drug. It's only going to get worse. Gives you a diuretic, which will deplete your magnesium even more. After a month, your blood pressure is worse. Your doctor says, we just caught your blood pressure in time. Here are some more blood pressure drugs. 3 months later, you have blood tests that reveal that your sugar is elevated and your cholesterol is elevated. These are both caused by magnesium deficiency. Your doctor again says, we just caught your blood sugar and your cholesterol. Here, take these drugs. In the next slide, the downward spiral, it's so common. I'm sure people listening, either with themselves or people they know, have gone through this cycle of taking medications and really not getting better. And the reason that the cholesterol rises when you're taking drugs is that the enzyme HMG CoA reductase, it makes cholesterol. Magnesium deficiency will, when you need cholesterol, magnesium slows the process when there's enough cholesterol. It speeds up the process of making cholesterol when we need more. But when you take a medication that kills this enzyme, then you just bash down your cholesterol. And what I'll be mentioning later is that with cholesterol being lowered, doctors think that's the best reason for taking statin drugs. But they have found that the lowering of cholesterol does not extend your life. So you're taking this drug, you're draining even more magnesium. Magnesium deficiency is a marker for diabetes. It helps glucose enter your cells and prevents insulin resistance. Without enough magnesium, blood sugar becomes elevated, and your doctor will give you a drug called metformin. And now, because you're in the realm of heart disease, Uh, and the drugs that you're on are said to prevent you from getting heart disease, but they're actually depleting more magnesium. They cause heart disease and even lead to heart failure. In the next slide, we'll look at arrhythmia. The electrical conductivity of the heart depends on electrolytes. The most important electrolyte is magnesium. But the medical and laboratory blood electrolyte panel does not even measure magnesium. Many people suffer from magnesium deficiency arrhythmia, and it's not a heart disease. Since the release of a new class of blood thinners, the diagnosis of atrial fibrillation has gone off the charts. As I mentioned earlier, even a new Apple Watch has an app to record arrhythmias, which will lead to dangerous overdiagnosis. You can read more about this in my recent blog called The Latest Healthcare Experiment. In the next slide, I'm quoting a Medscape editorial about screening for AFib. Is it a good idea? And what the U.S. Preventive Services Task Force said about electrocardiogram screening for AFib, they said there's insufficient evidence to assess the balance of benefits and harms. They found no randomized controlled trials supporting the benefits of screening, and they only identified one trial, and it provided information on the harms. About 15,000 adults aged 65 and older. There were more than 2,500 participants who had false positive results on their EKG in this screening study, and about 2,000 of them reported anxiety as a result of their misdiagnosis. The next slide, artery calcification occurs when there's an excess of calcium and lack of magnesium. And this can occur in all the arteries of the body. When there's not enough magnesium to dissolve calcium, calcium will build up in soft tissue. I think this was focused on more in the female population because they found that women who take calcium supplements are at higher risk for heart disease because of this buildup of calcium in their arteries. And the current North American diet and supplement ratio of calcium to magnesium is 10-1 instead of where it should be at 1-1. And as I mentioned earlier, all body arteries are subject to calcification. The carotid artery in the neck leading to stroke, and the kidney arteries leading to kidney failure. In the next slide, what they've done about this finding of calcification, they've developed a coronary calcium scan. It predicts heart disease risk so they can treat people at risk earlier to avoid heart disease. So it's this vicious cycle I mentioned earlier. If they think you're at risk, they'll start putting you on medications to prevent heart disease. And unbeknownst, they're causing heart disease. First of all, this CT scan they use emits X-ray radiation. Secondly, there's no medical treatment or drug that lowers coronary calcium. So they will still blame cholesterol, and they'll give people with a high coronary calcium score statin drugs. Medicine doesn't realize that magnesium is a treatment for excess calcification. And I've gone into this in another blog called Coronary Artery Calcification Increases Atrial Fibrillation. In the next slide, this is the book that I tell people is a must read. And I'll repeat, every statin study ever done does not show increased life expectancy, and doctors just ignore the results because they have to have something to blame, and drug companies need something to sell. In a recent blog, the author, Dr. Hendrick, capitulated and agreed that magnesium is important to prevent heart disease. I've sent him my book. I wonder if he read it. He doesn't quote me when he capitulates, but well, yeah, there must be something to magnesium here. So the next slide, because cholesterol is suspect now, people say, well, maybe it's not the cause of heart disease. Certainly statins are suspect. They're causing a lot of side effects. But at the same time, you have clinics like the famous Cleveland Clinic dropping the normal range of cholesterol to 100 to 199. When I was in med school, the average normal of cholesterol was about 240, 250. And now, again, because statins are suspect, there's a new line of cholesterol drugs to keep the myth going. The FDA first approved these PCSK9 inhibitors in 2015. And you can Google my blog about this, called Raising the Bar by Lowering the Target. Now, back in 2015, the FDA approved these drugs, the PCSK9s, only for familial hypercholesterolemia when statins weren't working. But by December 2017, a mere 2 years, these inhibitors were approved for preventing heart attacks, strokes, and coronary revascularization. It's quite a leap for a new drug to be approved for the most serious cases to be in long-term preventive treatment. And we really don't know the long-term side effects of something that's only been in the system for a couple of years. The next slide, heart failure. There's another blog that I've written about this. Hearts don't fail, doctors fail their patients. So this whole push for more and more drugs in heart disease is because doctors think heart failure is inevitable because they can't stop the decline in heart failure. And they don't know that drugs contribute to heart failure. So it's just a terrible, vicious cycle. Doctors just don't seem to be able to see the side effects of drugs or admit that what they're doing is not working. And I take a note from the banking industry where allopathic medicine is a huge institution that's too big to fail. In the next slide, I talk about the alternative medicines, confusion on heart treatment. Where is magnesium? When you Google heart supplements, you rarely come upon magnesium. CoQ10 is big, and all the others I've listed here. Some of them can be helpful, but I will say very blatantly and with great vigor that magnesium is the most important nutrient that you require to support your heart. Magnesium, the highest amounts are in the heart. If you don't have enough magnesium, your heart rhythm can be affected. Muscles need magnesium. If you don't have magnesium in the big muscle of your heart, it will go into spasm. Now, CoQ10 can be important for people who are on statin drugs, but even there, I tell people, look at all your minerals. We'll have an overview of the supplements I recommend. Do those supplements first before adding supplements just because they sound good on paper. And if you do take a supplement on top of the ones that I recommend, make sure that they're working for you. Make sure you feel that they're helping. In the next slide, I do have to mention about vitamin D. I say we have a love affair with it. What seemed to have happened is when calcium supplements lost their status after studies showing women who take them have higher risk of heart disease, then high-dose vitamin D became the latest fad. However, what I've found is vitamin D, and we're talking about vitamin D3 here, if it's above 2,000 IUs, it can pull out too much magnesium. You see, magnesium is required to transform the inactive vitamin D in supplement form into active vitamin D, thereby depleting the body of magnesium. So people in my practice and then our customers, they began having magnesium deficiency symptoms while taking high dose vitamin D. So I was alerted to the problem. If you take enough magnesium, you can make 1,000 to 2,000 units of vitamin D work for you. And Google my name and vitamin D and find out more details about vitamin D, the fact that it's a hormone, not a vitamin, and it should not be given in high amounts. And we should not aim for high amounts of vitamin D in our body. And the last slide I'll do before turning over to Ginney is just a repetition of what magnesium does. It's activating and catalyzing most of the chemical reactions in the body, helping make your protein, your RNA, DNA, transmitting nerve signals, relaxing your muscles. We mentioned the smooth muscles of the blood vessels being relaxed, relaxing the heart muscles. Too much calcium will contract those muscles. There are even drugs called calcium channel blockers because they know calcium can be a problem. However, they don't tell you that magnesium is a natural calcium channel blocker. And producing and transporting energy called ATP, 6 of the 8 steps in the production of ATP in the Krebs cycle, 6 of the 8 steps require magnesium. So if you're low on energy, you take magnesium. You don't get diagnosed with anxiety and depression and get put on medication. So that's what magnesium does, what I say about magnesium for the heart. And now in the next slide, we'll talk about helping your heart. But I'll stop here and ask Ginney if I've left anything out or if she wants clarification before we go into helping your heart, after which we will go over a number of frequently asked questions. Ginney.
Okay, I'm here. Can you hear me, Carolyn?
Yes, I hear you now.
Okay, great. Thank you. All right, welcome everybody. And great information, Carolyn. I think if you've been listening to Dr. Dean, you're probably so excited about what magnesium can do and some of the other recommendations that she's made. And you might have already gone off into your cupboards and rooted around to check and see, do I have any magnesium here? Or maybe you've realized, oh, I have some Epsom salts. I can go take a magnesium bath. And all those are good things to do. But before you do that, I want to introduce you to some of the things that you really are going to want to consider using to help rehabilitate your heart, to prevent any heart incidents, and also to relieve you if you do have heart rhythm symptoms that are associated with magnesium or mineral deficiency. So in the next slide, we're going to look at Dr. Dean's protocol, and this is a step-by-step way to start. Now, one of the things you can do right now that is to get adequately hydrated. And what Dr. Dean recommends is sea salted water. And what that means is a regular tap water or spring water or something out of your bubbler at home. And then you're going to add either a high quality Celtic salt, a pink Himalayan trace mineral sea salt, or some people like the Redmond's real salt. The difference between trace mineral pink Himalayan salt and the difference between Redmond salt is what country it comes from. The real salt comes from the United States. The pink Himalayan stuff comes from overseas. But any way you look at it, you're getting 72 to 108 trace minerals in your salt. And this is what she's inviting you to do. Water follows minerals into the cells where they are required for metabolism and cellular hydration. If you've never seen an animation of the inside of a cell, it is like a major factory. And every single little station in that factory requires a little mineral attendant to be there pushing buttons and pulling levers. And you've got to have all of them, all of them. And we know the big ones, the heavy hitters. We talked a lot about magnesium today. We'll talk about some others, but trace mineral sea salt, very important. And this is coming from when we lived by the ocean, as many people know, that we were getting it, even breathing it. But now we've got to create it for ourselves. Minerals and water in the cells prevent edema. Please note, we're not talking about sodium. We already know the warnings about sodium and table salt. That's not what we're talking about. We're talking about trace mineral sea salt, very good for you. You put that in your water and it goes into the cells and it actually starts to pull water into the cells and it actually reduces swelling and inflammation, if you can believe that, but it's true. It's what happens. And then also, you may not have known this. I did not know that dehydration causes the thickening of the blood and also possibly causes blood clots. And we have a lot of customers who are trying to get rid of blood clots and doing different strategies. Make sure hydration is your first step. It's your easiest step and it's the least expensive too, because water flows freely and easily to everyone. Okay, calcium is a factor. What we call factor 4 in the creation of blood clots. So you're going to balance your calcium with enough magnesium as well. But we want to get you hydrated. Your water intake guidelines is to drink half of your body weight in pounds, in ounces of water. So if you weigh 100 pounds, you're drinking 50 ounces of water. 200 pounds, 100 ounces of water. And then what you're going to do is add that quarter teaspoon of sea salt, Celtic salt, or Himalayan salt to every quart of drinking water. And then in one of those bottles, you're going to add some ReMag and ReMyte. So we'll go on to the next slide and talk about ReMag. ReMag is Dr. Dean's very own creation. It is absolutely saved lives all around the world, literally. And it is a stabilized pico-ionic form of magnesium. So what that means is, being pico-ionic, it's small enough to go into the mineral channels of the cells, and it does not require digestive energy from the body. Therefore, it does not cause the laxative effect. So it's not going into your intestines to be broken down in like a magnesium compound and then assimilated. It's going right into your bloodstream. We even think it's going right into the mitochondria. We speculate about that, but based on the results that people get, we can only assume that's what's happening. We are studying it and looking at it, and of course, stay tuned because we will reveal what the depth of how fast this mineral is being absorbed, this formula, and also to what degree in the body. But we know for sure it's going into the mineral channels of the cells and it's being immediately effective. The other thing is that it's concentrated, 60,000 parts per million. That means it's like taking a basketball and concentrating it to the size of a BB without losing the integrity of that basketball. So you're getting a concentration of magnesium you're not going to get in any other form. I promise you that. There's no form of magnesium on the market today that is going to give you the same concentration. And again, what does concentration mean? Pow, pow, power. Power in those cells to activate and to strengthen and to perform those biological functions, including beating your heart. Then the next thing that you've got to think about with ReMag is stabilized ions of magnesium. And it's super technical. We have an FAQ at support, S-U-P-P-O-R-T, at RNA Reset if you want the super technical breakdown. But just know what that means is it can do its own work. It does not require an amino acid or another compound to work with it in order to be absorbed. So what I just told you was power, power, power. Absorption power, performance power, health assistance power, and stability power. And all those forms of power mean that you've got to start low and go slow. We don't want you to just start chugging it out of the bottle or throwing it down your throat and also putting it directly in your mouth. We want you to start with half of the recommended dose, and we want you to start in a lot of water and sip that slowly throughout the day and get your body used to being awake, because it is going to wake up all of your body systems, and it's going to be delicious and wonderful, but we just want you to go slow. The next slide, we're going to talk about the sister to ReMag is ReMyte. A very similar mineral design in terms of the way it's constructed. This multiple mineral contains 9 minerals that support the thyroid function, and it also supports the adrenals. Now, Dr. Dean's had AFib. I've had AFib. I've talked to probably, I don't know, 6,000 or 7,000 people in the last 2 years with AFib. And one thing that everybody has in common is it messes up your thyroid and your adrenals. And especially just because your heart's beating fast, you know you're going to go into some kind of a panic attack or some kind of onset of fear. And that just kicks the adrenals in and ramps that up. And then we know where that goes. So what we've got to do is we want to get ReMag in the body. That's what's going to beat the heart. That's what's going to stabilize the electrical system and the conductivity of the body. But we also want to add ReMyte to support the adrenals, the thyroid, and all of our other glands and hormones that are working to balance the body and try to overcompensate when the body's in a crisis because of a heart rhythm issue. The majority of people we talk to are deficient in more than just magnesium. So again, the weakened adrenals and the thyroid. ReMyte is so precious. It's got so many good things in it. It's got zinc and chromium and molybdenum and iodine, and it's got selenium that goes with that, and it's got your calcium, just a little pinch, and it's got a little pinch of ReMag in there, and it's just a beautiful biologically appropriate formula that you can use to your benefit to, again, strengthen your electrical conductivity and the systems of your body, support your adrenals, and also your heart function. The next slide, we're going to talk about another great product for the heart, which is called Realign. And Realign is like a double, it's like twins, because part of Realign is just amazing for the heart, and part of Realign is amazing for the liver. And you think about two of the most important organs in your body, and you've got the heart and the liver, and this is covering both in an amazing way. The Realign is a detox formula, so it's going to keep your body detoxified. It's going to use those incredible B vitamins, which are all methylated, all in natural forms, and it's going to use methionine and taurine as well. And we know that toxins can irritate the heart, and a regular gentle detox is important. And we also know how important taurine is for that heart muscle, how important that B12 is for the heart muscle. So we've got just, again, more power in supporting your heart and your liver through the Realign. Another great thing about Realign, and I personally have seen this for the last 6 or 7 years myself, and in many of my colleagues and also teenage children, Realign is amazing at metabolizing alcohol. It will actually change the absorption rate of alcohol, and it actually prevents intoxication and hangovers. Well, what's cool about it is that is also protecting the heart, that you don't go into AFib or another cardiac event if you're consuming too much alcohol someday, feeling particularly merry. And I know this has happened to several of our customers. They've been on the products for a while, and they get giddy with excitement, and then go out and party, and they leave their Realign at home, and they forget, and then they kind of start freaking out because their heart picks up a little speed. We want to just encourage you to keep that Realign. You can take it with you and use it to prevent that from happening. Now, the next slide is about our wonderful, wonderful ReStructure. ReStructure is the most amazing, super yummy and delicious, super yummy complement formula. I want to call it a meal replacement, but the FDA doesn't allow you to say that. So we'll just say it's protein shake. But honestly, it is so filling. It is that thing that I just said before that I'm not supposed to say. It is a balanced protein, fat and carb meal with replacement assets for balancing the blood sugar, which can affect the heart. And ReStructure was originally designed as a protein to support people who did have heart conditions. It was designed by a cardiac surgeon. So that basis of design was then handed off to Dr. Dean, and she took it and designed it and built it up even more specifically to support yeast overgrowth elimination diets, and also lysine. She boosted it with a lot of lysine, which is very important for your immune system. And you know, if you have any kind of health challenge, you've got to keep boosting your immunity. But one of the greatest things about Realigned ever in the whole wide world is that it tastes so good. Very, very tasty. You can mix it with water, coconut milk, almond milk, or your favorite juice, and it's just super delightful and delicious. Our next slide is about the RNA drops. And one of the things about the RNA reset drops is they are a biological asset of epic proportions, and we're not really sure why. No, I'm just teasing, but it's kind of like that. They put me in the mind of homeopathy, for if you're familiar with that, of just giving your body a boost. They bring their own energy, they bring their own resonance, and they do have nutritional assets in them. Of course, they've got a balanced spectrum of amino acids. They've got a biological sugar that actually helps at the cellular level with cell replication. And then we've got some other beneficial aspects of the RNA drops. But mostly what I think about them is that they just give you a boost. They're kind of like a hedge of protection, or just a little stabilizer. And that's what we found when we tested them at a conference a couple years ago. We found that they just kind of balanced out of balance stressors. That's what I like to say. So RNA drops are also included in our product recommendations for the heart. They have a very good way of fortifying the magnetic field around the heart. And again, we've got information on that. I don't want to get too technical. Support, SUPPORT, at rnareset.com. Just say that you saw the heart webinar and you'd like the information about RNA drops, and we'll send you some more information about that. So that's kind of the completion of products that we want to recommend. But another thing that Carolyn wants to recommend is in our next slide, and that is that we want to manage yeast overgrowth. And here you may be encountering a brand new episode or brand new whack of information called yeast overgrowth. But what is yeast overgrowth is when your body harbors too much of what is originally a beneficial type of bacteria in the body, and then it grows up into something that gets out of control. And it actually creates toxicity from the GI tract into the blood and the tissues, and it absolutely can trigger heart palpitations. So this is another thing we want you to consider managing. You can read Dr. Dean's free book, Reset the Yeast Connection, to learn more. You would really want to pay attention to this if you feel that you're overweight, because, and if you have sugar cravings a lot, and you wake up first thing in the morning, you want to eat, and you got to have your sugar, got to have your donut or something like that. You really want to pay attention to that, because that is yeast driving and pushing you to be fed. So consider that information as well when you're considering all these things that Dr. Dean is recommending for you on how to naturally and safely rebalance your heart in, as you can tell, your entire cellular system. Everything that we're recommending, it is a holistic approach, ladies and gentlemen. It's not just do this one thing. It is get every single cell of your body saturated with magnesium. Let's saturate all of your cells with really good, biologically accurate minerals. Let's get all of your body treated and supported with methylated Bs and these things that it needs. Let's strengthen your protein systems of your body, your protein receptors in your heart muscle and throughout your entire body. Let's fortify your energy systems, your magnetic field, your resonance, and all those other places where you're alive with the RNA drops. That's what we're recommending, line upon line, precept upon precept. And then as you do those things, we also want to suggest that you consider maybe some dietary changes to provoke managing that yeast overgrowth a little bit better. Carolyn, did I say everything the right way?
Yeah. Yes, you really gave a great overview, and as you said, while I'm introducing yeast overgrowth, it's maybe TMI, too much information, but we do have a lot of resources. We're just open up the floodgates here for people to help manage their own health. That's what we're doing.
Very good. Very good. Okay, so I think we've come to the part of the program where we can take some of the frequently asked questions, Carolyn, that come up when we present this information. If you're ready to do that.
Mm-hmm. Yes,
Okay.
go ahead.
Okay, very good. So one of the questions that comes up frequently, and we went over it, but let's talk about it again from a different perspective, is how can you tell people that are hypertensive that they've got to use salt? Because that's like the number one no-no.
Right. Our water supply is filtered. It's filtered at the pumping stations. A lot of people filter it in their homes. A lot of people are drinking bottled water. And if you look on the bottle label, often it's distilled water or reverse osmosis. There are no minerals in our water anymore. So we have to get our minerals back. People get edema when they don't have enough minerals to pull water into their cells. You have to have minerals and water together in the cells to make them work. You made those points. I'm just reinforcing. If you think that salt is bad for you, think of it as Ginney said, it's a trace mineral sea salt with 72 minerals. If you don't like the taste, start with a pinch of salt. Don't overload yourself and think, oh, it's disgusting. At this point in time, 99% of our customers who are doing their sea salt love the taste and think water is disgusting when it does not have sea salt. So think about it.
Okay, very good. Now, when it comes to these heart conditions and things, do you recommend a stress test? What is that? Where are you with that?
Mm, that's more of a medical question. That's something that a doctor has to discuss with their patient. I don't not recommend them. I think I'll pass on that question, Ginney. If your doctor thinks it's necessary, then you probably have to go ahead and have the stress test. But then you got to realize that, what they're looking for could be evidence of a magnesium deficiency. I mean, this is the problem with getting stress tests or even getting an EKG, getting the Apple Watch with the Arrhythmia app. I wrote the article or the blog about the Arrhythmia app on the Apple Watch. And I had someone come back to me and said, well, he kind of likes it because it tells him where he's at with his AFib. I'm talking about people who out of the blue, they have some alcohol, they party, they put their watch on in the morning, and their heart rate is jumping a bit for good reason. And then they think, oh no, I have a heart disease. This business about healthcare experiments is all this overdiagnosis. You can read, there are a lot of books that you can read about the overdiagnosis and what that means when they what is it they do? Screening of people. They screen 1,000 people for a condition. They will get 20% false positives, and those people go on to have more tests and more treatments and the side effects from those just because they were overscreened. So it's a delicate question. Some people say, well, I'd rather know than not know, but sometimes denial is a good thing. You really have to weigh it. I often find when people come to me and they're very fear-based, I say, well, if you're fear-based about it, get the testing and try to reassure yourself. You cannot tell a fear-based person not to go to the doctor. That's just not practical or medically recommended. So I've talked myself into a corner, and Ginney, come and shovel me out.
No problem. Well, let me ask you this too. We know that there are a lot of people who are hitting their early 40s and 50s who have been athletes all their life, amateur athletes, or maybe they've been runners or tennis players, and they are now experiencing AFib for the first time in their life. And a lot of times these athletes feel like there should be an amendment for them in this protocol, maybe because they can do more or endure more. What do you think about modifying your protocol for specific conditions? Is that necessary?
No, I don't think it's necessary. We have all kinds of people who will start on our protocol, and they think they're strong and tough, and they'll just say, well, I'm going to take the 2-3 teaspoons of ReMag right off the bat. I'm strong and tough. And then they react because they're waking up cells, waking up biological systems that have been depleted of magnesium for decades. I mean, and it is very true, like Ginney says, athletes in their 40s and 50s, they finally sweated out enough magnesium that they just can't do it anymore. Their body can't scrub magnesium out of their muscles and nerves enough for them to support their heart. And that's what the whole serum magnesium business is about. The heart requires magnesium so desperately that it will keep pulling it out of the muscles and the nerves in order to keep the heart supplied. So what you have to realize, if you've been an athlete, if you've been on medications, if you know you're depleted in magnesium, that you have to slowly and deliberately take your ReMag so that you wake up your enzyme systems gradually. If you rev yourself up too quickly, then you can, start reacting. Your body can start really having a problem. I'm trying to be brief, but these are delicate and deep questions, and we have answered them in a lot of our publications and in our radio show archives. So we invite people to get involved with learning more information.
Very good. Now, one thing you mentioned earlier was that some drugs will deplete magnesium. How can I tell if the drug I'm taking, it depletes magnesium?
Well, I start people off by getting them to go online, go to Wikipedia, and type in the name of the drug and look at the chemical formula. If the chemical formula has a F beside it, it's a fluoride drug, and that fluorine ion can be disrupted in the intestines by the trillions of bacteria whose job can be to break down drugs. And then it's that fluoride that will bind to magnesium and make you magnesium deficient. Proton pump inhibitor drugs, they have an FDA warning that they deplete magnesium. I personally would say any drug will deplete magnesium, because in order to break down the drugs in the liver, in order to metabolize the drugs, you require magnesium. So you're using up magnesium in that process.
Okay, very good. And then what about L-threonate? I've heard a lot, a lot of people think L-threonate is super cool and groovy because it penetrates the blood barrier. Blood-brain barrier? What is that about?
Well, I was very upset when I read that study about L-threonine because they implied that only L-threonine crossed the blood-brain barrier, and that is blatantly not true. Even the 4% absorbed magnesium oxide crosses the blood-brain barrier. So they gave people really the wrong impression. It's a rat study. As far as I could tell from reading the paper, there was only a 7% higher amount of magnesium showing up compared to whatever magnesium they were comparing it to. So with a 7% um, difference, they made it out to the world to be that this was the only magnesium for the brain. So I mean, I don't know what else to say other than shortly after, maybe a year or so after, the product itself tripled in price because they patented it. So they created the buzz, created the need for it, and then they raised the prices.
Okay. Um, what does it mean when I relapse is a question somebody wrote in. I was using ReMag for 6 months and now my AFib is back.
Well, that can be people and that are only taking ReMag. We kind of ferret out that information at customer service. If you're only taking ReMag, kind of use a ReMag as a drug to suppress symptoms, but you have other mineral deficiencies and you need the ReMyte and the sea salt, or you're toxic and you need the Realign, or you have yeast overgrowth and you need to look at a yeast detox protocol. All those things are layers of problems in the body that we try to help point out to our customers. So in some people, it's not just about magnesium. And I'd say for most people, it shouldn't be just about magnesium. You should be looking at the whole picture. And we cover that with our complement formulas.
All right, very good. All right. I think I have time for one last question, and that is what do you do? Sorry. How long is this going to take? Huh. How long is it going to take, Carolyn?
Well, everybody is different because there are so many potential symptoms of magnesium deficiency in a person. We tell people just to really be observant about your magnesium symptoms, or you may find that you're sleeping better and you have less tension and you're in a better mood when all you were doing was taking the magnesium to help your heart. So, your heart symptoms, for example, I didn't get rid of mine entirely where I could skip a whole day of magnesium. I didn't get rid of mine entirely in that way for about a year and a half, but everything else was shifting. So people notice things pretty quickly, and then deal with the body's dealt with kind of in priorities. If the body doesn't think the priority is the heart and has to work on other levels, it'll do that. So again, this is what we work with in customer service to help people kind of guide their way through taking their minerals so that the whole body is affected. Body, mind, and spirit are affected by magnesium, and it does take some time, but usually people are noticing improved symptoms pretty quickly.
Very good. Excellent. Excellent. Well, Carolyn, this has been such great information, and we try to pack so much information in an hour, but then
I know.
we have so many resources for people as well to learn more and to become really well educated. And on our resource slide here in the webinar, we're going to show you how you can find more information from Dr. Carolyn Dean. The first one is the Magnesium Miracle 2017 at Amazon.com. Lots of great information in this book, 600 medical references, over 65 medical conditions. The heart is at one big one, but gosh, everything from acid reflux and on. And when you dive into this topic a little bit, you'll realize that, yes, you probably have heart palpitations, and you probably have blood pressure, and you probably have acid reflux, and maybe you have a little bit of arthritis, joint pain, and swelling. And then the next thing you know, you find out they're all magnesium related and mineral deficiency related. And then the next thing you know, you start using ReMag and ReMyte in our protocol. And then the next thing you know, you're writing and asking me for a job. 'Cause you're so happy and alive and recovered. All you want to do is tell people about the products and how it saved your life. So that's one place to start, is with the Magnesium Miracle. The next one is we have 11 free ebooks, and they're comprehensive. Some of them are 200 pages long. Dr. Dean just pours her heart out to people. You'll see on Facebook and other, media, social media sources, YouTube, lots of doctors with lots of information, and they want to subscribe and all the rest of this. Nope, Dr. Dean just gives it away under Dr. Carolyn Dean Live. Another thing that Dr. Carolyn Dean will do is she will meet you on Monday evenings at 7 p.m. Eastern, 4 p.m. Pacific, and 7 a.m. Tuesday morning Australia time if you're in a different part of the world. And she will talk with you through her radio program. She does a weekly state of the art, state of the nation kind of address, and then she'll take questions for an hour and a half and talk to you deeply and intimately about the things that concern you about your health and what she thinks you might be able to do to get your heart goals and your health goals the way you want them to be. So the radio show archives is also at drcarolyndeanlive.com. She has Atrial Fibrillation, Remineralize Your Heart. That's the protocol, and also a list of 33 triggers, which is very good to know what might be triggering your AFib and causing your magnesium deficiency to kick in. We have products that we sell worldwide at rnareset.com. And of course, Dr. Carolyn Dean herself, reaching out 3 or 4 times a week and just venting, looking at the landscape of the medical situation, organized pharmaceuticals, organized medicine here in the United States and around the world, and talking about how absurd and profoundly deranged it is, and or how wonderful it can be, or how challenged doctors are, or how dingy doctors can be. But she's laying it all out on her blog, drcarolyndean.com, and you can sign up for a free newsletter. So, and of course, at the very end of things is if you get stuck and you want to know what her opinion is, toe fungus, just Google toe fungus, Carolyn Dean MD ND, and you'll be surprised what comes up, because I bet she's written something about it somewhere. She also has her Future Health Now encyclopedia on drcarolyndeanlive.com, and that tackles over 300 different health conditions with supplementation, and also homeopathy, and also meditation, also different kinds of EFT and exercises. There's no end to the tricks she has in her bag and what she can recommend for people to avoid unnecessary surgery and not take dangerous or unnecessary drugs. So that's her mission. That's what we're here to do. We hope you've been highly edified and inspired that you may not have a heart disease. You may only have a magnesium deficiency. And I think we've shown you how easy it is to solve that problem here today. Anything you want to add, Carolyn?
No, we're good. We have filled up another hour, jam-packed it with information. So keep in touch, folks. We are definitely here to help you. Is anybody there? Hello?